Hi there. My name is Dr. Zeeshan Arif, and I'm here with Dr. Diana Tait. We're here today to celebrate the founding of the Royal College of Radiologists. So we're here today in central London. And what we'll be doing today is just having a conversation about how oncology has changed over the last few decades, really, and how we think it may change in the future, but also, very importantly, what hasn't changed, I think.
Having thought about today's conversation, the one thing that hasn't changed for me is the relationship with the patient. And that's core to everything that we do. And when I say the relationship with the patient, but I would also extend that to relationships with other staff members, colleagues in the medical team, obviously for us radiographers, specialist nurses. Those are the things that are just core and have not changed, that fundamental relationship.
Yeah, obviously I'm fairly early on in my career, but I completely agree with that. And I think the best teams I've worked in are ones where I think everyone is able to work together for the benefit of the patient. And I get a lot of energy, I think, from working with our specialist nurses, from our radiographers, and just sort of seeing the collegiate relationship they have with the medical team. I think it's been really, really good for me. It's good for my experience. I've learned a lot from them.
Interestingly, when I started, and for many years, there were no specialist nurses. So, I think now, I don't know how we would function without specialist nurses.
I'm sure you've seen the complexity of treatments themselves have changed quite a lot, have they, over the last few years, would you say?
Yes, just when I think now about how we do radiotherapy and the sort of details of planning and the 4D and the, IMRT and SBRT. I mean, the whole thing would have been sort of like some sort of fantasy if you'd told me about it 40 years ago. You think, don't be silly. So yes, huge developments. And of course, patients have benefited from it. I mean, we don't see the toxicities that we used to see, and cancer outcomes, not as good as we'd like them to be, but they are improving. Yeah. And that's the radiation side of it. I mean, systemic therapy, there were, 3 or 4 drugs that we juggled around with in different sort of cocktails. But now, I mean, there's, not just with chemotherapy, but all the immune therapies. It's a different world.
The rate of, for me personally, the rate of change is what really drew me to this specialty. I think that the way things have changed, the way things continue to change. I remember when I was a more junior doctor, I'd hear about people going off on maternity leave, coming back, and the scope of treatment for their disease has changed. Yeah, completely lost. The way you sequence treatments would have changed.
AI capabilities that I don't understand at all, but I believe are out there, that we could be looking at huge developments again, even faster in the next 10 years. You better fasten your seatbelt. It's going to be a fast ride for you. And of course, the challenge for healthcare organisers will be harnessing that at the right time with the best advantage and at a cost that can be afforded. I suppose one of the worries I would have is that we will use AI more, and we will use much more sort of electronic contact with patients. But there is something sort of reassuring about talking to another human being and having things interpreted, or being reassured, or being told bad news, but in a way that, it's done with kindness and care.
The worry is that you lose that personal contact with the patient. They can fill in plenty of forms and it's very helpful, but nothing is more reassuring than, I think, putting your hand on a patient's tummy and knowing that it's soft, and knowing when it's rigid. I think not much tells you more than that, really. And I think that's something we should really fight to maintain and keep.
Yes, I think we should be using all the technology that we can, but sort of rooting it in a continuing human framework.
Yes, absolutely.
Yeah. So I imagine for you, and the MDT is kind of core to most of your daily life. Yeah. Can you imagine when there wasn't such a thing as an MDT?
Well, as a registrar, I mean, just even sitting, often sitting in the back of the room, and just trying to glean on wisdom and seeing the shared wisdom, sometimes even the robust back and forth that can happen about some patients, that is really valuable, because when sometimes you see a radiologist report about a scan, often it could seem like it's just the truth, it's fact, it is what it is. And I think an MDT will prove that actually it is subjective and each patient is different. Sometimes stuff isn't as black and white as it seems on the scan. And I think I can't imagine not being able to lean on shared wisdom, shared experience, both in terms of new developments, in terms of other people, shared clinical experience about molecular markers, some of the stuff that we get from pathology, availability of clinical trials in various parts of the country. The patient, someone may know of something that might be right for this patient. But as you've kind of alluded to, the thing that's really energizing about this job, that I think patients in the end of all of this not the most necessarily, but the thing that energizes them and energizes me is actually the human touch and being able to spend time with patients during what is a very emotionally tumultuous time and seeing them through it. It's the reason that I really enjoy their career, with the ups and the downs, and I have so far. And I think that for the next 50 years of the college, we need to fight to preserve that.
Yeah, well, this has been a really nice opportunity to have this sort of reflection and projection. So we look back, we're looking forward, and it's been really interesting. I've enjoyed it.
I have as well, Dr. Tait. It's been lovely speaking to you and to do this, and I think it has certainly made me more hopeful for the future, which is something I don't think we could say as much anymore, but it certainly has, yeah.